If you usually suffer with heavy and painful menstrual period, and also you pass blood clots as big as a 50p coin, you need to be booking an urgent appointment to speak to your doctor. There are some causes of heavy and painful menstrual period, most especially if you usually have normal periods and all of a sudden you began to have heavy and painful period. I'm just quickly going to run through the secondary causes of painful and heavy periods: fibroids, endometriosis, adenomyosis, sexually transmitted infections or sinister causes such as womb cancer or cervical cancer. Now, people who have heavy periods could suffer with low blood level due to the fact that they lose more blood than they should be doing. And there are some symptoms associated with low blood volume. So symptoms include headaches, feeling as though you want to faint, tiredness or mild physical activity, shortness of breath, chest pain, feeling as though your heart is racing. Some can also suffer with low iron, and symptoms will include loss of hair, memory concerns, restless leg, amongst others. So, what are the self-help measures that you could start doing prior to seeing your doctor? You could get some over-the-counter iron tablets and also use it with vitamin C tablets in order to increase the absorption of the iron, and improve your diet by eating more greenish vegetable, red meat, and so on. Having said that, your doctor will request some investigations, which might include doing some blood tests, include a scan. And what is a scan looking for? The scan is looking for any womb structural abnormality or some abnormal growth, such as fibroids. Check the lining of the womb thickness, especially in people who have polycystic ovarian syndrome or other possible causes of heavy periods, such as endometriosis. That one is usually done with a more specific scan called the laparoscopy. But do not forget that endometriosis will also make your periods more painful and more unbearable. Now, they could request some tests if you are at risk of sexually transmitted infection, because chlamydia and gonorrhea can also cause your periods to be heavier than usual. Now, many a times they might not find a particular cause, but do speak up if your periods are unbearable. It's imperative that you continue using the iron tablets for at least 3 months after your iron levels have come back to normal. And they might offer you hormonal treatments such as the Mirena coil, which can help to stop your periods completely, and is also good for the lining of the womb. There is a good study that shows that Mirena can help reduce the risk of womb cancer. Now, that said, if you do not want to deal with hormones, they can offer you other treatments such as tranexamic acid, which can help to reduce the volume of blood loss, and also mefenamic acid, which can reduce the pains that you usually experience. If you found this video informative, it means other people would. Please like, share, and save for later. Thank you.